Well, Canada has rapidly been expanding access to medical aid in dying, otherwise known as MAiD. Some see this as a necessary thing, while others see this as dangerous. Joining us to discuss this in more detail is Mike Schouten. He is the executive director of the Association for Reformed Political Action and also has a deeply personal connection to the topic regarding his family. Mike, welcome to Bridge City News. It's great to have you on.
Thanks for having me.
Absolutely. Firstly, you're going to be one of the speakers at the Canadian Religious Freedom Summit taking place at Metropolitan Bible Church in Ottawa this Saturday, February 3rd. And I believe the focus of this conference is on MAiD, right? So can you maybe explain a little bit more?
Yeah, for sure. It's a conference that the organizers felt they wanted to just use the opportunity to help the church understand how to, as Christians, how do we respond to the expansions to euthanasia in our country? How do we respond to people who are suffering, who do want to die? And how do we do this in the face of, yeah, like I said, more and more access to euthanasia and the legalization of it?
And I understand that people can actually watch online, but they need to get registered first, right?
That's correct. I think it's freedomsummit.ca. They can go to and get all the information there. It's fairly straightforward. I've been assured by the host that there's approximately 500 people who are attending in person, and then about another 1,000 who have already registered online. So, of course, online they can take any number. So, if you would like to take in the conference, you're welcome to do that.
All right. Okay. So the focus of this conference is on MAiD, or medical assistance in dying. Now, March 17th was the date set for Canada to expand medical assistance in dying to those whose sole underlying condition is mental illness. But perhaps somewhat surprisingly, the federal government has decided to follow the parliamentary committee's advice to put a pause on this for now. So can you maybe give us a little update of this?
Sure, yeah. And just quickly for your viewers going back, this was a sunset clause that had been included in the original legislation back in 2021. Between 2021 and 2023, when that sunset clause was set to expire and people with mental illness could request euthanasia and receive it, there was incredible pushback, not just from Canadians and religious Canadians, but from psychiatrist associations, from people who have been struggling with mental illness, saying to the government, saying, what are we doing here? Like, are we really giving enough attention to how this is going to end up in disaster for many people who are dealing with mental health struggles? So the government in 2022 introduced a bill that delayed that sunset clause by 1 year. So you're right, it was set to expire March 17th, 2024. And just this week, the government indicated that Canada's still not ready for this. And they're this morning indicated that they're going to introduce a bill to delay it another 3 years. So the government seems still intent on making this legal. That's unfortunate. We think it should never become legal for people with mental illness. But the reality is we have 3 more years to continue advocating for those people and those vulnerable Canadians. So hopefully, God willing, the day will come when they're not susceptible to MAiD.
So, what exactly do politicians mean when they say Canada isn't ready yet for MAiD based on mental illness alone? What would need to happen for the nation to be ready for this?
Yeah, it's hard to really ascertain that. I mean, there's many in the medical community who will indicate we're ready. You know, just make it happen and we'll deal with it, kind of thing. I think this is cover a little bit for the government at this time to just put this off until after the next election. 3 years from now will be after the next federal election, so they just don't have to deal with it for a while because they were recognizing that politically this was becoming something that was not attainable for them. They weren't going to essentially they weren't going to win votes by doing this. They were probably going to lose votes. So let's just delay this further. That's what we think is happening, which is unfortunate because yeah, while this gets dealt with in the political realm, it is a deeply personal issue and it affects human life. We're talking about life and death here. Really, we are. And it's unfortunate that at times it does get politicized, but at the same time, like I said, we're thankful that it's not going to become legal right now this March, and we have time to continue advocating for those vulnerable Canadians.
Yeah. Now, Mike, you yourself are someone who has a very personal experience with this subject. Your son Marcus passed away after a battle with cancer. Can you maybe share a little bit about that experience?
Yeah, it was a very hard road that we walked down. I had been in my capacity with ARPA Canada working on this issue for quite a long time, and it becomes kind of cerebral, like just it's a policy issue, and you're working at it from that angle. And then at the beginning of 2021, February 2021, our 17-year-old son was diagnosed with bone cancer. It had metastasized already at diagnosis, so that the prognosis didn't look good. He underwent about 20 rounds of chemotherapy over the course of the next year. And then, about 2 months before he passed away, we had to make the decision with him to end treatment for cure and just focus on treatment of the symptoms and live life as best we could for those last 2 months. And Marcus passed away on May 29th, 2022.
I'm
So
so sorry.
yeah, it's definitely harder now that he's gone. It was a hard road to walk, but
Yeah.
just knowing that he's never going to come back and sit at our table anymore is it's really hard, and sometimes you just actually don't know how to deal with it. My wife and I obviously are believers, and that's where we put our hope and trust. And we also feel like this conference we're talking about in Ottawa at the Metropolitan Bible Church is an opportunity to share with people there, and as many people who want to hear the story, is that there can good can come from suffering.
And
I
Marcus, I
think
believe,
as
was 17, you said, right?
yes, yeah, he's
Oh,
only 17.
unreal. Did doctors suggest a maid at all?
Thankfully not. So Marcus was 18 when he did pass away, and he legally he could have requested MAiD, but when he was diagnosed, he was still a child, 17. So all of his treatment occurred at in British Columbia here at the BC Children's Hospital, and then all of his palliative and hospice care was taken care of and administered by Canuck Place Children's Hospice. So in those facilities, MAiD uh, is not a solution to suffering. So we're very thankful that that wasn't something we had to deal with at that time.
Did you feel that the palliative care was done well?
Oh, it was superb. I think we experienced in the child track what we can do as human beings insofar as treating people who are suffering from terminal illness. And Marcus he died essentially from drowning, his lungs filled with tumors, and yet he was still able to live every day that God gave him and experience some joy, some pleasure in every day. And as a family, because his care was provided through Canuck Place Hospice, we were able to just spend those moments with him, and we'll cherish that forever.
Yeah. Do you think that he's someone that would have chosen maid had he had that opportunity presented to him?
It's, I would pray that he wouldn't have, and I think that because of the way he was treated and the perspective that the medical community had towards him, he wouldn't have. And that, I think that perspective is something that we've sometimes lost in our country, where when someone's suffering, then they see themselves as a burden, and we affirm that they are a burden. Then that person is going to despair, and when despair sets in, then the desire to die is only one step away from that. But if the person who's suffering, as Marcus's oncologist actually said to him when he told him that there was no more treatment available, Marcus asked him, he said, "Doc, how long do I have?" And the doctor said to him, he said, "Marcus, we don't know how long you have, but what we promise you is that every day that you do live, we're going to ensure you live it to the best you can." And that perspective didn't lead Marcus to despair. He was able to enjoy those last 2 months.
Amazing. And after your son's death, you testified at the Federal Assisted Dying Committee, and I'm sure that was difficult to do. So, how did MPs respond to your views and your testimony?
They were, I think, appreciative of that perspective. There were some definitely who you could feel like a real worldview clash in the room when we were presenting to them and the questions that came. Some of them obviously were pro euthanasia and pro euthanasia even for minors. And that was hard to deal with. We really had to stay focused on the subject matter and just trying to encourage them to really consider whether or not you as a country want to expand to the realm of minors, because that's not legal in Canada right now, but it's something that's quote unquote on the table for discussion. And the committee at that time was discussing the topic of minors and euthanasia or medical assistance in dying and wanted to hear our perspective. So we're very grateful for that opportunity to just share our testimony and our lived experience with how even when your child is suffering from a terminal illness, there can be even joy found in that suffering. And it really is that perspective we have towards it that is going to either encourage someone to request to die or encourage someone to just live life to the fullest as long as they have it.
Right. I'm surprised they came at you like that. Like you think there'd be a little bit more sensitivity there.
Like I said, it was a worldview clash, and they peppered us for about 45 minutes with questions after we shared our testimony, just trying to get out of us that, you know, for some people this is good. It might not be good for you, but for some people they might want this.
Right.
And we really, yeah, like I said, really try to stay focused on the points we wanted to make.
Exactly. And you had
Um,
your own story to tell, and yeah, like what really could they expect of you? So, what kinds of specific support and treatment options would you like to see put in place that could potentially help those considering MAiD to choose to continue living instead?
mhm. I think there's two parts I would say to that. One is the responsibility of the church. I think we have a huge responsibility to seek out people in our spheres of influence, whether they be coworkers, neighbors, elderly people in our communities who are lonely and who are suffering, to come alongside them and ensure them that their life has value and we care for them. The other component is strictly within the medical system, and I think that Canada needs to put far more emphasis on palliative care than we currently do. There is incredible supports available for people who are suffering from terminal illnesses that ensure that their life is comfortable in spite of all the ailments they might have, that their life is comfortable and that their loved ones can be with them, just spending that time together, making those memories without having the distraction of constantly running around town trying to find the latest medication to assist and help.
Mm-hmm.
So we experienced that from the Canuck Place Children's Hospice, and so we know that we can do it. Now, just it's a matter of will our country and our government officials and healthcare professionals will they put priority on that?
Mm-hmm.
And if they put priority on that, then I think that there's a lot more that can be done for suffering individuals.
Right. What kind of feedback have you been hearing from physicians? Are they supportive or against MAiD based solely on mental illness? I know with your case it was a bit different, but we're talking about mental illness here.
Yeah, that's a good question. On the mental illness side, you don't find many physicians who are in favor of MAiD for mental illness. They recognize that mental illness is very complex, and there can be seasons of life where somebody is feeling very down and feels like their life is not worth anything. And then that changes, and they begin to flourish again as a productive member of society. So one of the key terms you'll hear in the debate about medical assistance in dying is irremediability. And that means that whatever disease or condition you have is not fixable, like it's not going to get better. You cannot ascertain that for mental illness because there's so many fluctuations. And for that reason, I think doctors are very cautious to speak favorably about MAiD for mental illness.
Yeah, that's kind of a slippery slope, isn't it? Yeah, no, and interesting. How far do you think that this could go?
When hmm, when Canada legalized euthanasia, then ARPA Canada at that time we said we now that we've crossed the line whereby it's legal for some human beings to take the lives of other human beings, it's going to be very hard to say where that line should be because and that's exactly what we're seeing play out. It originally was for people who were their death was reasonably foreseeable. It was imminent. They were going to die within a few days, so they could speed that process up by requesting MAiD. And now it's for people with disabilities. We're talking about mental illness. We're talking about minors. So we've come to a place where if some people can get it, why can't other people? So it's very challenging where to draw that line.
And then on the other side, what are the proponents of MAiD saying? Why do they believe that it's such a positive thing for individuals to qualify for MAiD based solely on mental illness alone?
Yeah. So the proponents actually just they say exactly what they want, and I think they want it to be available to anybody who wants it. If you're suffering from anything, whether it be a bad marriage or a disability or a mental illness, anybody who's suffering, this should be one of the tools in the suite of tools that a physician has that they can use to treat, quote unquote, treat your suffering. And the senators, especially in Canada's Senate, are very open about that's where they want to see this end up, where there really is no rules. Anybody who asks for it can receive it.
Kind of more like a human rights thing, like if it's your right to, it's your body, your choice type of an argument. Okay. Any final thoughts on what people can do to prevent the expansion of MAiD if that's what they believe?
hmm Yeah, I think there's a political response to this. So be in touch with your members of parliament, your MLAs, and encourage them to not expand this any further. You can go to arpacanada.ca to find ways in which to do that. The other response is a what I call a pastoral response, and that is when there are people in your life, and we all have them, people who are suffering. Do what you can to affirm their dignity, affirm their value, and share with them that they are worthy, so that any despair that they might have, that doesn't lead them to that next step of thinking their life is not worth living anymore. So those two responses, I think, can go a long way to ensuring that the number of people who are requesting euthanasia gets lower and lower and lower.
Well, thanks so much for being with us today, Mike, and for sharing your story. Appreciate it.
Thank you.
Mike Schouten is the Executive Director of ARPA and will be speaking at the Canadian Religious Freedom Summit taking place at Metropolitan Bible Church in Ottawa this Saturday. You can join the summit online by registering at freedomsummit.ca. I'm Jeanette Roche on behalf of all of us here at Bridge City News. Thanks so much for watching.